everyone, welcome back to my channel and welcome to all new viewers. My name is Olka and I'm a UK-based vet, and today me and two other vets will tell you about our experiences working during the pandemic. Before I get to it, please don't forget to like, subscribe and ring that bell if you enjoy my content. I aim to release a video every week. The coronavirus pandemic undoubtedly affected everyone, some more than others. It affected our social lives and professional lives. I can't think of any industry or profession which wouldn't be impacted by it one way or another. Today I invited two other vets to share their point of view about how it affected them and their place of employment. Thank you to Catherine and Jade, who agreed to speak about this issue and spread some awareness regarding what vets have to deal with in the current situation, both mentally and professionally.
Hi, I'm Jade. I'm a small animal veterinary surgeon working in the northeast of England. So it changed pretty quickly. Immediately the practice broke off into teams so that only set people were working with each other and clients weren't allowed in the building. They were probably the first changes. I was meant to be abroad at the time, so I was actually on annual leave. So when I came back, I wasn't part of any team. And also because I was having to try as much as I could provide care for one of the shelters we do work for, I wasn't able to join a team immediately. This kind of left me with, quite isolated, not too much to do to fill the time, and I did end up taking furlough for a bit of time, which is gutting. When you want to do your job, you want to help your colleagues, but you can't for everyone's health and safety. It is a bit rubbish to basically have to be at home and know that they're in the thick of it. When I came back, we managed to make a smaller team at one of the branches where we were still very much in lockdown, no clients in the building, socially distancing between team members. So, it was just completely different to anything we've done before. Consults took twice as long purely because the owners can't come in the building. You have to take the animal, examine the animal, then talk to the owner about their concerns and what your findings are, come up with a plan. And normally this is stuff you would do simultaneously, and it just completely, changes your routine. All routine operations stopped. So neutering, unless there were health reasons or severe behaviour reasons, just had to stop. We had to stop vaccinations, so that's like a bulk of our day is your prophylactic health alongside your sick animals. And to get rid of all that, it became a little bit soul destroying that everything we saw was sick. We take a little bit of respite in those consults where the animal is healthy and we're just doing checkups and we're getting to know our patients, getting to know our clients, and all of that was just gone. So it was just completely different. Like, everything changed. You didn't know what the next announcement was going to be, what that change meant for your team and you, and then all the PPE added and everything. I could talk about that for hours about how different it went.
Hello, it's Cat Pig the Vet. I am a vet who's been in practice now for 14 years this year. Oh, that feels like a lifetime. And I can honestly say this year has been the biggest challenge. This last year has been the biggest challenge in my entire career. Initially, the first thing that happened was that all staff other than veterinary surgeons were furloughed. After about 2 days, they started to bring support staff back because they realised that vets cannot function on their own, and we're hopeless. So that was the biggest change. We also have had to change our day book quite a lot because it takes a lot more time because clients are not allowed into the building. We have to have people to help us hold pets, help us with treatments, putting up medications and things. So it takes twice as long. We did have 10-minute consults. We now have 20-minute consults. Day book has altered rather so that there is more time. Well, more consults are fitted in, and there is less time, unfortunately, for the phone calls and all of the other paperwork and things. There are a lot more missed meals and missed break times, not quite as much time for actually taking the weight off your feet a little bit, which is hard when you're getting older, to be honest.
I personally worked only a few months during the pandemic. I decided to leave my job in July or August, don't remember exactly. There were a few reasons for that, but the main one was my health. But a few days after having left my job, I found out I was pregnant, and very happy about it. How did my daily routine change when I was still at work? Well, not much, to be honest. There were certain changes implemented in the practice, but the overall routine stayed pretty much the same. However, our bosses decided at the time to close the practice earlier to allow for a catch-up before the day ended. My personal life was massively affected, and my day routine changed 180 degrees, from working a lot, being out and about, to basically being contained in four walls majority of the time. And I won't lie, it is very much frustrating.
In ways, yes, and in ways, no. So, yes, definitely in the sense that everything took longer. I did find that a lot of animals, no, not a lot, some of the animals were more stressed coming into the building without their owners. Wearing PPE, particularly visors, things like that, do actually really interfere. Animals don't particularly like it either. Things that were slightly easier, should I say, is that some animals are much better without their owners in the room, as awful as it sounds, and they are much more amenable to physical exams and being able to get things done. But that was like a very small consolation.
Did the pandemic make my job more difficult? Hell yes. Yeah, simple answer. I think the time constraints and sometimes unrealistic customer expectations have made it very difficult. So yes, in short, it has made our job a lot more difficult.
It did and it didn't. One of the rules implemented in my practice was that animals had to be held by vet nurses for examinations and any treatments at the back, whilst owners waited in the consult rooms. Whilst it is very nice to have your colleagues and professionals help you, you would usually end up running around the practice every consult looking for someone who was available, which was taking much more time. Another thing, I personally struggle with talking and breathing with a mask on, but of course I appreciate it is the safest thing to do.
I think it's the isolation. So for me, the breaking up of teams. When you work in veterinary, your colleagues are, not to sound really cheesy, but your colleagues are a bit of a family. You get through everything together. The job has really great highs, horrific lows, and you're all a team. You all lean off each other, support each other, drag each other through it. And when you're suddenly put into a team and you don't get to see 70% of your colleagues, only just the odd phone call because you're all too busy to, even talk for any length of time whilst at work, it's really quite isolating, and it did break down that team feeling for a little while. I mean, it's back now that we're together and rotating better, not normally, but that for me, that was the worst.
I would say time constraints and client expectations. I think sometimes you just feel like you've got such a lot to fit into too short a space of time. There's only so much time in each day. Sometimes your efforts can just seem a little bit futile when the waiting list never seems to go down and you're just not getting all your chores done. It's also quite difficult, I think, when clients have the same expectations that they had pre-COVID-19, and you just can't keep up with them. So I think client expectations and time management, it's not possible to time manage any better really, but it is a trial, definitely.
So definitely not having that freedom to be able to, do your own thing outside of work definitely has an impact when you then go into the building. You're spending 90% of your time with, especially in a fixed team, with the same people again and again. I was lucky, my little team were lovely, wasn't as plain sailing the whole way through, but it definitely puts a dampen on your mental health. You can't do, how do I word it? Yeah, you don't have that time to decompress like you normally would. So going out, spending time with non-vetty people, seeing my family, all of that is respite from the sad things we see at work, the hard things we see at work. Just being able to switch your brain off properly, that all went. So my mental health definitely took a toll. I know a lot of my colleagues, it definitely took a toll. And, you know, I think you'd be of strong disposition to be anyone that got through this pandemic, regardless of what you do, without having some mental toll from it. So, yeah.
Yep, and it still is, and I think everybody's mental health has been affected. I think that the work-life balance obviously can't be there at the moment. We don't really have much life outside. I'm lucky I've got a couple of things that I can do outside of work, but not having the support network of friends and family means that you do have to lean a little bit more heavily on your workmates, and I think life can become all about work very, very easily, and if you feel like you're not quite as appreciated perhaps as you should be, then that can make it a lot harder as well. Definitely, I don't know anyone whose mental health has not been affected by this. Just a quick addendum to has my mental health been affected? It is obviously affected by the attitude of our clients, but I should say that when we have a really grateful client, it makes a huge difference to how our day feels. So when people say thanks, it actually makes far more of a difference than people realise. So keep doing it. Thank you.
Definitely. Not so much by work, but by the pandemic and the restrictions. The combination of lockdown and pregnancy took away the majority of things I used to enjoy. We can't see other people, I am not looking for another job as not to expose myself to the infection whilst pregnant, can't take part in any hobbies outside, etc. I honestly can't wait for it all to be over.
The only thing I think patient care wise that was affected was your prophylactic health, so your vaccinations, your neutering, your routine procedures. Those were things that just had to be put on hold because everybody's safety had to come above that. Apart from that, no, I think we managed as a profession really well to keep services how they should be, in terms of patient welfare, patient workups. We've had the added complication of Brexit, meant some drugs and, you know, things maybe weren't available for short periods of time, but we got over that incredibly quickly. There's nothing that really stands out that I think there was any shortfalls when it came to patient care.
I think yes, in that we have less time, unfortunately, to deal with each individual. So we have to try and be quicker, we have to try and jam more into each working day. So in that way, I think it's impossible not to let it affect patient care to some degree. Initially in the first lockdown, the guidelines were obviously saying no contact where not necessary, and to try and use remote consults, so either video consults or telephone consults where possible. So there were a lot of things that weren't obviously emergencies that we were trying to do remotely, and we did actually find that there were a lot of things that it was just delaying treatment in. It was difficult to get an accurate diagnosis. Nothing makes up for a really good clinical examination. So unfortunately, I think we discovered during the first lockdown that it doesn't really work very well. It just delays proper treatment, and it makes everything a lot more difficult and takes longer as well. So I think those are the main effects, really.
Other than prophylactics like vaccinations, routine neutering operations, etc., no. Vets have been and are available for urgent and emergency care. So if there is something wrong with your pet that cannot wait, you will be seen.
Absolutely. I know a lot of owners weren't happy not being able to come into the building with their pets. We're now allowing one person in with a pet to, if it's possibly a difficult procedure, sensitive procedure. So if they're saying goodbye, basically. And that does affect people. It's hard to, you know, if someone's looking after your pet, they are a member of your family, and if you don't get to properly meet that person and discuss with them, and it's hard to build that level of trust and reassurance when you can only have sort of a phone call with them, and to just place your baby in their hands and then you know, hope everything's done how it should be. I mean, absolutely it will be, but it is difficult. I completely get that, and I think it did affect it. And then obviously having the limits on how many people can be in the room when they say goodbye to their pets, that's awful. None of us want to have to do that, but unfortunately we can't have crowds of people in the room. We're currently allowing 2 people. I know some practices are only allowing 1, some even none, and it's heartbreaking, it's awful, and it's something that we can't wait to get rid of and have things return to normal.
Owners tend to worry about practices closing and essential services being unavailable, but so far, again, other than prophylactics, veterinary surgeries have been operating as normal. Lots of owners also don't like not being present at the physical examination, as they worry about their pet, but in majority of cases it really isn't necessary.
I quite, controversial because a lot of my colleagues don't, I quite like telemedicine. I think there's definitely room for us to offer more services online. You know, it's never going to replace an in-person consult, but when people genuinely can't make it down for just your routine checks, things like post-op checks, or, you know, just check-ins for, say, your long-term arthritic dog that's doing well, things where maybe the owner definitely can't get down. I think there's definitely room for that, for us to provide more services like that. Whether that actually takes off or not, I'm not sure, because it is a bit of a grey area that you are very limited with what you can offer in terms of that, but it would free up some workload in very niche places.
Not most of them. I think most things that we've got to deal with at the moment are quite limiting and quite frustrating, and I think most people would say that. The only thing that I might be tempted to continue with is sometimes getting other people to handle pets instead of owners. When you can see that an owner is quite stressed, sometimes it's actually better to step away with the pet, and I think that has really been brought home by this situation. We just see so many pets who are a lot less stressed in the veterinary situation than they might be normally. There's quite a lot that we see who, on the notes previously, we've got notes about them being really nervous and really worried, and they come in on their own and they're actually really good. So I think just being aware of that, and perhaps changing tactics a little bit sooner and using other handlers might be something that I carry over from this.
Nurses holding animals. Brilliant. Probably unrealistic though.
Absolutely. So yes, I mean, I'm not worried 100% of the time like I used to be. I tend to get to work, wear my PPE, do my distancing and sort of forget about it. But when you've got now clients coming in with masks below their noses, and you wonder how, you know, and you see on social media people going out, mingling, what have you. I mean, I'm not going to be telling on anyone, but it makes you think, how responsible are they being in their free time in terms of keeping themselves and their families safe? And then I have to be there to keep their pets safe. And it does worry me. It's not something that I can think about too long, because we've just got to get on with it. We've just got to, you know, provide the care for the pets. But it is a bit of a worry. Yeah, I'd be lying if I said I wasn't worried I'd catch it.
At the moment, yes, because I'm pregnant. If I wasn't, I wouldn't. I simply think I'm not in a group with a massive risk. I'm relatively young without any underlying conditions which could make the symptoms worse. I would be worried to pass it to someone else though.
So we are required to get changed once we get into the building. Then for each consult we need to wear a mask, a visor, gloves and an apron. And then we change gloves between patients, and apron and mask between consulting sessions that are like 2 or 3 hours. So yeah, pretty hot.
Currently we have to wear a mask and an apron and gloves and a visor or goggles as well, which does make life a little bit difficult because you steam up regularly, and I have frequently been seen tripping up steps and tripping over dogs and my own feet.
We have obviously all the rules we've spoken about already, about only one person in, wearing correct PPE, social distancing and all of that. We have yellow stickers in the reception area where people have to stand on one of those until it's their turn. For the team, it's things like, you know, keeping 1 metre distance. Then we also have to have our own bowls and cutlery and mugs that we have to keep separate and washed. Like all the communal stuff's been locked away.
In our practice, we have a locked door policy. We have done since the beginning of the first lockdown, so it's nearly a year now since we had clients in the building. So we come outside, we take a history, and then we bring the pets inside to do our examinations. So all clients remain outside. They have to ring to arrive themselves. They're all told that they must either call the practice, or we have a mobile number for them to text to arrive themselves for their appointment, because obviously they can't come in. Some people forget their phones, so they have to hammer on the door. We obviously have the 2 metre rule. It's a little bit difficult in smaller practices, obviously. Staff can't stay 2 metres apart all the time, and you can't when you're handling things either. So as much as you can, 2 metres apart at all times. When you're within that 2 metres, all of your PPE. We also need to have 2 metres distance from clients where you can, even outside, and a lot of the time people don't realise that we'll need them to wear their mask when they're handing over their pets and things as well.
The rules introduced at my place of employment at the time were masks for the staff, limited amount of clients in the practice, examinations of pets away from the owners as to avoid unnecessary contact, more frequent and rigorous cleaning regime, sanitizing hand gel for the owners to use.
For food production, absolutely. And exporting food, importing food, definitely. Small animal, I think only the emergency side of things. Prophylactic, I completely get it that we need to keep up with vaccines so we don't have an outbreak in the future. So in that sense, yes, it is essential. However, we do have a time period before a booster is no longer valid, and we need to be making full use of that time window to reduce how many people are coming in. You know, sadly, with the rise in lockdown puppies and all these puppies coming from everywhere, the demand for that is through the roof. So it just, you know, has kind of undone some of the measures we've put in to keep our teams safe. So yes, kind of an essential service. Things like nail clips, unless they're a welfare concern, routine neutering, you know, there's always other options that prevent them needing to come into the building for now. So yeah, food definitely, without question. Small animal, sections of it.
Emergency veterinary healthcare is essential, and I think that routine things become essential at a point. If it's short term, then your routines really aren't essential. And I think that you have to be really careful and really sensible about being responsible and making sure that other people are responsible, not travelling excessively for reasons that are not really necessary, and reducing contact obviously as well where it's not necessary. I think a lot of people are still kind of thinking it's business as usual. There's a lot of things that are still going on that I think perhaps shouldn't be. There's still people going out shopping for booze and cigarettes and non-vital things. Sometimes chocolate is vital, I know. But there's still quite a lot of things going on, and the rules are not that clear, so I think sometimes people are sort of manipulating it to be what they think it should be. And at the end of the day, you know, things like routine dental care and routine neuters and nail clips, especially a lot of the nail clips that we see aren't actually necessary. These things, they can wait. So I think emergency healthcare, yes, but general day-to-day, no, it probably isn't. But it gets a little bit muddier when time sort of moves on, and this has been going on for a while. I think we've got to start looking at vaccination programs and things as being a little bit more important, because if we let a lot of vaccines lapse, we're going to start seeing more cases of parvo and more cases of lepto and things like that, unfortunately.
This is a difficult question, and I think that definition would change massively depending on how high the mortality caused by coronavirus actually was. At this stage, I couldn't justify letting pets suffer or die in pain by closing down veterinary practices. Would it be justified if this virus had, let's say, 10% mortality rate? In a scenario like that, I think we'd need to reevaluate again what essential actually means. But overall, looking at some other jobs or professions that are considered key or essential, I do think veterinary service should be provided, especially in urgent and emergency cases.
Controversially, no. I think again it goes back to that food sector, yes. Small animal, no. We can provide emergency care on skeletal staff, and we often do in emergency situations, so I don't believe that all of us need to be labelled as key workers, but I know that's a controversial opinion, so don't shoot me.
As per my last answer, probably not. I think emergency, yes, but general day-to-day, you probably need to have reduced teams that are classed as key workers, but I think you've also got to consider the impact on other key workers if we are classed as key workers, on transport, on childcare, on local infrastructure. I think it puts more pressure on others, so we've got to be careful to be as responsible as possible, and try not to do more than we absolutely have to.
In the current situation, yes, I think so. There is a shortage of vets in England as is, which results in overburdening vets with work, long waiting queues to be seen and stress among vets as well as in owners. If we cut back on the number of vets and vet nurses even more, that would only worsen the situation.
It's on a scale, isn't it? I feel less safe than at home, but safer than in a supermarket, so I guess that's a win.
Yeah, most of the time. You get the odd person who, whilst running backwards, they'll continue to chase you and try to get within a metre of you whilst smoking a cigarette and coughing in your face. But for the most part, I think management has been very good at making sure that we've got as much PPE as possible. It's not always ideal, but we're not put into any positions that we're not comfortable with, and clients generally are pretty good. If you ask them to put a mask on, they generally do. There's not very many people that make you feel unsafe generally at work.
I have to say, I didn't. I was seeing many people every single day. However, I wasn't worried about getting coronavirus really, as I wasn't in a high-risk group. Now though, that I'm pregnant, I wouldn't risk it.
Absolutely, the whole team. It affected everybody in different ways, but predominantly everyone, we've got this shared feeling of, oh, when will this end, and the stresses, and you know, we all just keep having the same conversation again and again about how rubbish it's been, basically, and how we can't wait for things to kind of get back to normal. So definitely
yes, everyone's mental health has been affected. I think some people have found it harder than others. Some people have found it harder to find an outlet for their emotions, and some people do just feel really drained and exhausted, whilst others kind of cope with it better. I think that's always going to be the case, unfortunately. I do think on the positive side, we are getting better at seeing when somebody needs something, when somebody is struggling a little bit. We're learning to read each other a lot better. We've all got a lot closer, and we work a lot better as a team. I think I'm answering the next question as well. The effect on my relationship with other work colleagues. I think we've all pulled together a lot better, and I think that we have all learnt to support each other really, really well. We've all learnt each other's little nuances, and kind of when we need to give somebody a little bit of a time out and back them up a bit. I think that's really improved probably over the last 6 months or so, we've learned to do that really well. I think the sense of humour becomes a lot darker as well. Maybe that's just us, but yeah, definitely in our practice we all had a dark sense of humour anyway, but it's got even worse.
When I was still at work, it was still a fairly new situation we found ourselves in. And back then, from what I could see, our mental and physical health wasn't as affected as it is now. I imagine though, practice owners and managers were put in a very difficult situation trying to deal with all the changes and adjustments to make it safe for staff and clients, but also from the business point of view. But I am sure the more time passes, the more this pandemic affects people. And we will close our conversation with that question. Are you surprised, or is this what you expected to hear? Regardless whether you are a vet, vet nurse, a veterinary receptionist or a pet owner, I hope we helped you understand what vets have to deal with a little bit more. If you are struggling, whether you are a vet or in a different profession, please speak to someone about it. It isn't easy and you're not alone. I hope we will overcome this difficult situation we found ourselves in soon. I wish you all the best. Try and keep healthy and safe. And lastly, thank you for watching. I hope you liked my video. Like, subscribe, and I hope I'll see you here again soon. Bye!